those of you who want to look back at it or are not able to stay for the whole time today, you can take a look as well. So these are some of our ongoing projects. We have a spreadsheet for all VIR training programs. This is getting updated as we proceed through the year. We have multiple series, such as our How to Crush Your Sub-I series, the Acute Care series with Dr. Desai, no relation to me, the WCVIS Match series, which you're at right now, our Unite and WCVIS series, our Landmark Trial series, and then we're also putting together educational resources, such as procedure guides for Spanish-speaking patients. We also have several mentorship projects, such as the Mentor Match and Resident Office Hours, and we have an upcoming podcast on 100% VIR practices and much more. So if you're interested in joining the WCVIS trainee section, please sign up at this link or scan the QR code and follow us on social media at WCVIS Society on X or Twitter, Instagram, TikTok, and YouTube. You can also add the Google Calendar to stay up to date on upcoming events and check out our website at wcvis.org. I'm just going to leave this QR code up for a couple of seconds. All right. And before we start, just an upcoming event we have, part of our acute care series, anticoagulation reversal with Dr. Kanant Desai, Tuesday, July 14th at 6 p.m. Pacific. You'll be able to learn the fundamentals of acute bleeding management in VIR alongside a deep dive into a landmark RCT on urgent anticoagulation reversal. So without further ado, I'm going to introduce some of our panelists. So first up, we have Dr. Subhash Gutti. He's a PGY3 who went to the George Washington School of Medicine and Health Sciences and did both his surgical intern year and VIR, and is doing his VIR residency at Rush University Medical Center. Then we have Dr. Tulsi Talluri. She's a PGY2 from the Oakland University William Beaumont School of Medicine. She did her surgical year at the Kaiser Permanente Surgery Program at the Los Angeles Medical Center, and she's doing her VIR residency at the University of Southern California Keck School of Medicine. And then Dr. Ashley Lamba, a PGY2. She went to the Donald and Barbara Zucker School of Medicine at Hofstra Northwell, did her surgical intern year at UCLA, and is doing her VIR residency at UCLA as well. So I'm going to stop sharing here and just spotlight our speakers, and then we'll get started. All right, so for this panel, we're going to have some prepared questions in the beginning, and then there'll be some time at the end for an audience Q&A. Okay, so I want to start off by asking, what made you feel that a surgical intern year was the right fit for you over other options such as internal medicine or a transitional year?
So I'll kick us off. So at least at Rush, we are a categorical program, which means that when you match into our integrated IR program, you automatically get placed into our surgical intern year. So in other words, you don't have a choice if you match at Rush, you're automatically in the surgery year. And Ashley, is UCLA the same way?
Yeah, it's the same.
Okay. Okay. So a lot of like the IR powerhouse programs have categorical training pathways, and I knew that a lot of my top choices were categorical programs, which automatically placed you into surgery. So I kind of just accepted my fate. If I had the choice, would I have chosen a surgical intern year? I'm not sure. It was kind of intimidating when I was a medical student, but now being several years down the line and looking back, I'm really happy that I did do a surgical intern year, and I feel like in retrospect, there you learn so many crucial skills and you gain so much great experience. So I'm really happy that I did it.
I can go next. I just realized you guys, it was built in for you guys. It was categorical. My program is an advanced program, so I had to choose an intern year. I could have picked an internal medicine year. I could have picked a TY year. Um, Personally, I chose surgery because um, of many reasons. One of them being during my medical school training, surgery was like my favorite rotation after IR. So it just made sense for me to spend a whole year doing surgery rather than medicine, which I didn't enjoy as much. I still enjoyed a lot, but not as much. And then also just because of like the workflow and lifestyle of a VIR, I just felt like surgery made the most sense for our specialty as well. In VIR, we're taking care of very sick inpatients who are, you know, suffering from like hemodynamic instability, sepsis, and all these other things who were trying to like answer the clinical question, should we take them to the IR suite or not? And if not, and if so, what should we do? And these are all the same questions that surgeons ask as well. And it's a lot of like pre-procedural management, peri-procedural management, post-procedural follow-up that was like, it's just kind of like makes a lot of sense because it's the exact same way surgeons think. And it was an easy choice for me because of that. Um, and the other thing was kind of like the daily, like day-to-day workflow was also very similar to surgery because in the morning you're coming in at like 5 a.m. doing like your very quick pre-rounding and then your gravity rounds and then you're off to the OR. Like it's the same thing in VIR. You're not spending like 3-4 hours rounding on patients and then figuring out and then talking to consultants and all these things. So it's the same exact thing in VIR. You get there very early, you do your pre-rounding very fast, you tell all of the teams that your plans, and then you go off to the OR. So I felt like it would have prepared me the best for a career in VIR. And so far, I'm glad that I did it. But obviously, everyone has different opinions.
Yeah, I totally agree with what Felicity is saying. Even though I mastered a program that was categorical, there was many programs I ranked that were advanced programs, and I did end up ranking my surgery intern years the highest. And the reason behind that is I think that there's just so many skills that overlap with IR or VIR, and I think that, like kind of like what Dulcie said, you need to learn efficiency, especially when you're in a procedure room or an OR all day. So you have to be able to do your floor tasks and accomplish things when you're doing things like in between or seeing consoles in between, versus like when you're on a medicine year, you have that more of that luxury of time where you can kind of sit and think about your patients for extended periods of time, which is great. And I'm sure you learn a lot in a medicine year, but it's not necessarily always applicable in the VIR setting. And I also think that when you do a surgery year, you kind of just get comfortable touching patients. And I've noticed that when you interact with some of your medicine colleagues, they like for example, when you're a surgery intern, you get consults from the medicine team and they'll consult you for something and they never even examined the patient in the first place because they just never thought to do that. So you kind of like learn the art of the physical exam, seeing the patient in person, being able to touch them. And that's something that it has a lot of overlap with VIR, of course. So I have no regrets, and I highly recommend anyone to do a surgery year.
Sounds good. Kind of in line with this, some of you briefly touched upon it. What misconceptions did you or do you find other medical students commonly have about a surgical intern year?
Or the question was, what are
Um,
common misconceptions
mhm,
about a surgery year?
yeah.
I think, what I was most scared about was that, the environment is extremely toxic. You're just like a scut monkey. You're just, doing floor stuff all day. You're not respected as a physician. I mean, I'm sure it's different from program to program. And I think there's also like some regional differences, but that was not my experience at all. I felt that I was highly respected as a member of the team. Obviously, there's floor tasks that have to get done, but I was assigned to the OR pretty much every week, if not multiple times a week, based off of the rotation. You go to clinic, you kind of see consults yourself. There's like a lot of autonomy that you get, and it's graduated. You don't get just like thrown into it. There's always someone there watching over to make sure you're doing things correctly. But I think that, that was kind of one of my biggest fears was like, okay, like I want to do a surgery here because I feel like, I want to be able to operate on people, get suturing experience, things like that would be applicable to VIR. But what if I don't get that? What if I just have to be on the floor all day? And I didn't think that was the case.
I think from my side, when I was a medical student, one of the thoughts I had was, why is it so important for me to do a surgical year if I want to do all endo work and not be doing open surgery in the operating room? And I didn't fully appreciate how much of the year was about clinical management, not just being in the operating room. And now, where I'm at currently, and looking back on my whole experience and seeing what things were most valuable, it's 100% the clinical experience, like both Tulsi and Ashley were talking about. I have very strong opinions on the idea that surgical interns are way more autonomous than compared to any other interns in the hospital. You look at it this way, all these other services like internal medicine, they have seniors who are constantly around, able to supervise, able to kind of micromanage. Whereas when you're on general surgery, all of your seniors are busy operating in the operating room, and oftentimes it's up to you by yourself to be responsible for all these patients on your service, to make those critical decisions like sick or not sick. Do I need to escalate? Do I need to ask for more help? A lot of things you're managing on your own once you feel comfortable. So it's kind of just circling back to the original question, what's a misconception? I think there's so much value to gain clinically, and it's not just about the operating skills.
All right, so we can move on to the next question. I know some of you mentioned that you were in a categorical program versus advanced, but if applicants do have the opportunity to choose their surgical internship program, what factors should they prioritize when deciding between programs, such as location, quality of training, things like that?
I think for me, as far as picking like the actual program, not my intern year, like the advanced versus categorical programs, it was based off of location and also um like good training. Like that was a priority for me, like kind of in par with location, is I just wanted to like get the best training that I could. Um and also it's a place that you're going to be there for like 5 to 6 years for. So that's why location was also important to me. I wanted to be at a place where I could enjoy like the state, the city that I'm in. And then for picking like my intern year for any of the advanced programs in those locations, I also didn't really want to move twice. So it was a lot of like, what's a really good surgery intern year that's in this kind of vicinity that I could stay at. Um, but of course, there were also like decisions I made, like if I were ranking a like a California program, like I really wanted to be in California, but it was an advanced program, maybe spending like my intern year in New York would be cool because then I could try out a city that I would never be able, probably not live in later on, just for like a year. So it took a lot of like self-reflection of like what I wanted, um, even visiting those areas for away rotations or even just like casual vacationing to figure out like what is the lifestyle that I would want for like 5 to 6 years. What kind of city do I want to live in? Um, where do I have a support system? These are all like kind of the most important things for me, at least.
You guys will kind of learn when you're making your rank list. Sorry, I might have cut out. You guys might learn when you start making your rank list that you can attach the intern year to the program. So for example, like based on your, let's say like you can rank all the California programs and I want to rank a California intern year. So you can kind of like pair them together. So like it's not just like, you imagine like two different parts of the country. It's kind of like something that's kind of within your control. I think that in terms of choosing a program, it's really person dependent, kind of like what Dulcie said. It's really dependent on what you prioritize. Some people want to go to just, the best program there is. Some people actually feel like they have a better surgery intern year experience at a community hospital because there's less of that hierarchy, there's less fellows, maybe you get more operative time. You kind of like get an idea for these different things when you're in your interviews and you kind of hearing from other people who did the intern year in the past. Um, for me personally, I kind of prioritize location. I wanted to be somewhere where I had a strong support system. I lived at home for intern year and I still currently live at home, which I love. So would recommend.
Yeah, like I said earlier, it's kind of hard for me to answer this question because all the programs I liked the most were all categorical. But I do want to echo the fact that intern year is it's such a culture shock. You're like a real doctor for the first time. You're so busy with work, your hours are crazy. So support system is super important to prioritize. So, if you have a partner or family in a particular location, like definitely don't underestimate the value of those considerations. Um, Additionally, well, everyone on this panel is a surgical intern year person, but um, if you feel strongly about wanting to go a different route, whether that's a medicine year or a TY year, those are certainly options as well. I think it's important to point out that while you may have certain preferences and things that may influence you to rank certain things higher or not, intern years in general are super competitive. Transitional years are super competitive. Even medicine years are quite competitive. And so you can't really always predict where you're going to end up or even what kind of year you're going to end up in if you don't end up at a categorical program. Um, but no matter where you end up or what kind of year you have, just try to get whatever value you can from it. Try to see things that are related to IR or try to just be as autonomous as you can and take on responsibility.
Thank you so much. And then, kind of in line with that, when you were applying and interviewing, were there specific rotations, program characteristics, or learning environments that you were looking out for as you were kind of making your choice on which program was best for you?
Sorry, so you're talking now about like how you ranked your IR programs, IR
Yes.
programs?
Yes, exactly.
Yeah. I mean, this question's a whole can of worms, but I think first things first, hone in on what factors are most important to you. In my opinion, my main criteria were strength of training and the way I defined that was what types of procedures is this program doing and what is the volume of procedures. That was one. Location, you have to be somewhere that you're happy. Um, and three is culture of the program. Ideally, you visited this program, maybe you've done a rotation with them at least for a month. You can see how residents interact with each other. So those were my three main criteria. And I think IR programs are so different from each other. It's way different compared to things like surgery or medicine. So it's very easy to kind of pick apart the differences.
I think it's honestly very challenging to rank a program based off of your experience in the interview. Obviously, like for interpersonal stuff, sure, but like finding out like how strong the program is and what types of procedures they do. Pretty much every program kind of says the same thing. It's like, oh, we do interventional oncology, we do this, we do that. Like they all do it, but like how much do they actually do? And it's kind of hard to tell unless you do a sub-I there. Because VIR programs are very different from program to program. You'll see, like, when you do your rotations, that it could just be like vastly different, the volume and the case complexity. And it's kind of hard to tell that just off of an interview. That's kind of why, like a couple years ago, I helped with the VIR spreadsheet for WCVIS because we've been trying to get case logs from these programs just to get a better idea of how many of these types of procedures that these residents do, which has been kind of able to help mitigate that gap. But I think that the best way to figure that out is primarily through sub-Is. So I recommend doing as many as you can in your fourth year.
Agree with everything Ashley and Sposh said. Also during my interviews, like when it's time for us to ask questions, every single program I asked like the resident, um, what's the coolest case that you've done like in the past week, not just like ever. And then also like what's all of the things that you've done in the past week. So like that kind of gives you like, because I also asked like every program for case logs and you may or may not get them. So this is kind of like an on the spot kind of way to like put them on the spot and be like, what exactly have you done this last week? And then you can kind of see like what are the most common procedures they're doing. And also um I would ask, oh, the other way you can kind of tell how strong a program is by like how much clinic the residents get and how often like do they get to see like consults and how autonomous they are with like fielding the consults and like the procedures as well. So I would focus on like not just the procedures, but like these other two areas. Um, and you know what kind of clinic or what that clinic looks like too is like, is this like a longitudinal follow-up clinic or is it like pre-op post-op clinic? Um, and that kind of gives you a sense of strength of the program as well. Yeah, it's a lot to think about, but uh, the best way is to do an away rotation because then you can really get a sense of all these things.
One other thing I forgot to add too, very important to know autonomy. That's like extremely important when choosing a program. There's a lot of those like ivory tower type programs that seem really great and they do really complex stuff, but a lot of times the attendings are doing it and the residents are watching. So you kind of have to get an idea either through an away rotation or just by having a conversation with the residents there, like what are the types of cases that they're doing at their level and what are they able to do independently. I just very distinctly remember during the interview trail, there was a program I was really interested in, and I asked PGY5 what he feels comfortable doing, and he said that he started to feel comfortable doing ports by himself now, and that was just like immediate like bottom of the list for me, just compared to a lot of different programs where like I put in ports by myself as an intern, like that's something that's just very different in terms of autonomy, so it's just something to heavily consider.
This question is like there's so many pearls that we're getting right now. Everything Ashley and Tulsi just said is like gold. So, audience, I hope you guys are taking notes, or whenever you get closer to the stage of deciding how to rank, make sure you call on your mentors and ask them these questions. In particular, Ashley, you mentioned you worked on the case log project for different programs. And I don't know, I think that's public right now, right? We have case log information
Hmm.
on some programs.
Yeah, I think it's on the website.
Yeah, so maybe one of our moderators here could put in the chat at some point during this talk. Hugely valuable resource. In my opinion, if a program is really proud of the experience that they can afford their trainees, they have nothing to hide. They're gonna publish their case logs. So definitely look at that. Yeah. And oh, it was so true, Ashley, what you said about every single program looks the exact same on interview day. Interview day to me is essentially useless in terms of assessing how to rank programs. Like you get no information. You got to go there in person. Or another valuable thing that you can do is talk to recent graduates from that program, recent alum, and see in their first 2 or 3 years, what are they capable of doing out in the real world? What kind of jobs are they taking? What cases are they comfortable doing on their own?
Or talk to fellow MS4s who did a sub-I there. Yeah. All right, so now moving on to the patient management bit. I know we covered it a little bit before, but how do you feel your surgical intern year changed the way you approach patient care as a vascular and interventional radiologist?
So much, like everything. Um, I just think of like so many specific patient interactions where I feel like if I had done another kind of intern year, I would have felt way less equipped. Like just most recently, this happened several times throughout the year, but most recently, um, so at my intern year at Kaiser, it's a setup where we have like the call team is composed of an intern, a junior, and then a senior. And the junior is the one that carries the consult pager. The junior and the senior are the ones that are like always required to go to the OR and the intern is taking care of all the floor stuff. But, whenever there's the junior and the senior in the OR, the intern, me, usually is the one that's seeing the consults or helping out in the OR, just kind of like being extra hands wherever is needed. Um, we got a consult on call for like this patient. The medicine resident called us saying, we have a patient, their leg is kind of cold, we can't really find a pulse. This isn't really a serious consult, but maybe we're just not using the Doppler right. Maybe you guys can come help us out. So I was like, okay, let me go see him. And I, like do the whole thing. Of course, there is no Dopplerable signals. There's no palpable pulses. It is a cold limb. And, I just like, I don't freak out. I just kind of start the whole like, you know, acute limb ischemia workup. And then I go down to the OR and I tell them all these things. We have these like plans in motion. This is the history and everything. And they're like, "Hey, sounds good. Like book them for the OR." Um, and like that just kind of happened very seamlessly where I feel like if I had just kind of been thrown into that as a fourth or fifth, like R4, R5, who had never done that before, it would have been very scary. Um, I mean, this was like literally a third year medicine resident calling me asking that. And so like I think it just kind of went to show like how important that surgical intern year was for that moment and everything that like not even just the clinical management part of it, but even like the nerves and like calming and like don't worry, like you know how to do this, you can figure this out. Like even that, like that was like it like goes miles to like be calm in those kind of scenarios.
When you go through your surgery year, you'll learn that like surgical patients and VIR patients are one and the same. They're that have the same pathologies. A lot of post-op patients end up needing VIR intervention and vice versa. It's kind of like a collaborative interaction. And I think that, being able to see these pathologies every single day, being able to rotate on SICU when you're an intern. I rotated on liver ICU at my program. Those are all VIR patients, and being able to understand the physiology of what's wrong with them, being able to go into the OR and actually see what we're doing to these patients and what type of postoperative complications can happen, that's all very valuable stuff that will be very helpful for your further years to come. Um, at least, for me personally, I think that, even though there's medicine patients that also like, learning medicine is very important for VIR as well. It's just so much there's just so much overlap that I just don't think you would do yourself a disservice if you end up doing a transitional year, for example, where you're kind of rotating on a bunch of different things, and at the end of it, you just don't feel very comfortable in anything, which is kind of the experience that I've felt, when I was a med student interacting with some of the more senior residents who told me that they did a transitional year. It felt that it was more of an uphill battle for them to end up on the same playing field as the people that did a surgery year. And we have like 6 years of training, which seems like kind of a long time, but it's honestly really short. And I personally think that you should just make the most of the experience if you can.
I liked Tulsi, I liked your example. It is so common for that exact scenario where crap hits the fan and the surgery intern is better able to manage this situation than a senior resident on a different service. And that kind of just summarizes the value of the surgery intern year. Your every day is dealing with very high acuity situations, emergencies, crap hitting the fan all the time. Everyone kind of turns to the surgery team to figure out what to do. And that's an invaluable skill to have. Just like Ashley said, IR patients crash all the time, and you want to have that skill. And like Ashley was saying, 6 year program, but the meat of it, the majority of it is diagnostic radiology, years 2 through 4. You're sitting in a dark room, you're not exercising your clinical brain at all, and really you're relying very heavily on your 1 year of clinical experience that you got during intern year. So you want to make sure that you really flex those muscles, like you really have strong clinical foundation, because that is what's going to last you kind of the rest of training and beyond. Whenever you rotate on IR or ICU for 1 month or 2 months or whatever per year, you want to have that clinical intuition, that clinical experience for whenever things become kind of emergent or high acuity.
Okay, so our next question was, did your program incorporate any VIR exposure during the surgical intern year? And if so, how did you find that added value to your experience as a VIR resident later on?
So one nice thing about being at a categorical program, integrated program, is that we from day one, even as interns, we're very plugged into all of the VIR programming and education. So we do like approximately 2 days of VIR lecture in the morning every single week. Even as interns, you can leave your surgical service and go get that routine learning. And I think it's really important to have that like very routine exposure to IR so that you can keep building on your fund of knowledge and that you're not going away and disappearing for long periods of time and forgetting everything that you knew. It's kind of like building a sandcastle. You got to put the sand in there and put the water in there and keep stacking it up constantly for it to stick. So we do 2 months of VIR and on top of that, 2 months of vascular surgery in our intern year. So altogether, that's 4 months of strong endovascular training.
That's cool, Subash, that your program has like the 2 hours of VIR education every week. That would be nice. I think our program should do that too. Um, I Our program has 1 month of VIR training during the intern year, which I found super beneficial. It's kind of also like, when you're in the trenches of a surgery year, having a month of VIR is like a nice reminder of what you're doing this all for. So, it's great. Not all programs have it, of course. It's nice when they do. Um, I do think that I keep, but can you guys still hear me? Okay. Um, I think like, from my experience, it was nice. We got kind of a mix of experience between seeing consults and also being in the VIR suite all day. Great experience. I think that, it's nice in some ways going to a categorical program as well, because you get to kind of interact with your faculty at your program, as well as interact with some of the surgery faculty and the seniors, because those are the people that you're going to interact with for the rest of your VIR career when they consult you for things. But I understand that there's many really strong VIR programs that just don't have a combined intern year. And I think that you could still have a good experience without having that month or two in your intern year.
Yeah, that's really cool the way that your guys' categorical programs integrated it. My program again is advanced, so the intern year was separate. So I did mine at Kaiser, and there they have us all do like a month of elective. And most of us prelims were VIR interns, so my elective month was VIR. And then we have 1 month of vascular surgery, which is basically very integrated with VIR. It's a lot of endovascular stuff. And so basically 2 months was VIR. And then even during both those months, we were obviously doing like multidisciplinary vascular conference. Um, and that's basically like the meat of it. And then in each rotation, there's so much overlap with VIR, like our main trauma ACS rotation, basically every day, the intern, I was the one going over to the VIR, consult room and talking about all the patients that we had consults for them. And same thing with a lot of the other primary rotations we were on, like surgical oncology, there's a lot of overlap with VIR. So there's a lot of me talking to VIR about like plans for patients or um, literally on my 1 month of ped surgery, there were 2 cases where VIR like came into the OR, and we were working on like combined cases, like whether it was like an ablation, or some like random thing. Like there was pretty much every rotation I was on had overlap with VIR, and that was really cool because it, allowed me to get involved with both sides. So highly recommend if you are going to do an advanced program, picking an intern year that's not only surgery, but like also has really good integration with the VIR department at their program.
Thank you. So my next question is a more general one, but what resources, habits, or strategies do you find helped you succeed during your intern year? As you mentioned, it is a very challenging year. So looking back, what do you think you might have done differently, or what advice would you give to us med students?
So I'll I'll keep it real. So during my surgery year, the hours were so long. It was grueling at times. And honestly, I didn't have much time to like study outside of work, and I wasn't really that wasn't like a huge priority for me to read in the books the ins and outs of general surgery. You learn so much of it on the job. And it's not really something that you can just read and like not really apply. Like everything that you're learning, you're applying to your patients right in front of you. So in terms of like what advice I can give to you all, it's more so just like about your overall mindset and approach to all of this, because you truly have to make a big mindset shift. As a medical student, you're constantly building towards your eventual like match process, and you want to look super polished. You want to look perfect. You want to hide your mistakes or your weak points. Whereas once you start residency, you're already in. Like you don't have to worry about being perfect anymore. You're gonna make mistakes. You're gonna be like bottom of the totem pole again. You're not gonna know what you're doing. And it's okay to be like, hey, I'm weak at this, or I straight up don't know what I'm doing. Like somebody help me. Like I don't feel comfortable. All of that's okay. And you really just gotta like humble yourself and realize that that's okay and that's totally normal. And everyone's gonna feel like really dumb a lot of the time, and that's just part of the learning curve. So, yeah, just get used to like being uncomfortable, not knowing, get used to asking for help, and just kind of embrace the novelty of it all and the challenge, and immerse yourself in all of that, and you'll come out strong.
Hard to agree that there's just no time to study in your surgery year. You don't need to study in advance. You don't have to prepare anything. You learn basically everything on the job. There was like a couple rare occasions where I studied some things here and there. Like if I was on ICU, like I needed to like relearn like the vent settings and like what like metabolic acidosis and all this stuff is. Like that stuff like you can read up on when you're at work, but there's just really not much time to study at home and you don't need to. I also would like sometimes read up on the case, like if I'm assigned to a case, like I'll just like read up on the steps of it just so I don't look super dumb in the OR. But they don't pimp when you're an intern, you don't really get pimped as much anymore compared to a med student. So it's like I was never just like scared of looking stupid. Like if you don't know anything, like that's okay. You learn on the job. Um, my advice when you start intern year, kind of like what Subash said, it's like you're not going to know anything, but you kind of just have to embrace it. I kind of approached intern year like as if I was pretending to be a general surgery resident. It just makes the day so much more fun when you're actually happy to be there. It's no fun if you're just like dragging your feet all day waiting to be done with a year. You know what I mean? Like it's a long year. The hours are long. Being able to embrace it and just be like happy with what you're doing is like game changing in my opinion. And then also prioritize sleep is what I recommend.
Yeah, I think you guys summed it up really well, but I just wanted to also add that like when you're spending like all day at work, you kind of have to get really creative with how you study. It's not like traditional studying like Anki or like whatever we did in med school. It's a lot of like learning from our patients. Like that's how I remembered a lot of the things from intern years because I saw it real life in my patients. And I would ask questions like, okay, why are we doing a pylorus sparing Whipple versus a traditional Whipple? And you'd ask these questions and you try to like that's I think in my opinion the best way to learn. Um and like just like these clinical decisions that your attendings make, try not to just blindly follow it and try to like critically think about why you're doing what you're doing. Why are we taking lymph nodes in this patient and not in this other patient? Like, just really try to ask those questions and that and you'll be so surprised at how much you remember and how much you learn from that. Um, and also like even though we're spending like up to like, 80 hours per week, there is some downtime between those hours. Like maybe you have downtime one day and that's when you decide to do all these like prepping for your cases and prepping for like in general, like prepping for the week. And that's kind of where the learning happens. Also, I would like tailor my learning, not just random learning, but like to each case. Like, for example, if I keep bringing Surg Onc into this because that was my last rotation, but like last month I was on Surg Onc and we were, every week we would have multidisciplinary tumor board. We would be trying to figure out like what kind of surgery does this patient need, if any. And there would be like so many back table episodes on like that very thing. Like, how can we as VIRs like make our surgical oncology colleagues like have them the easiest time in the OR? And like, how can we help them out with like our procedures or like our patient care, blah, blah, blah. And like, you can like, it didn't even feel like work or studying to me because I was genuinely curious. Like, oh, I want to know like what this person did. So like I would listen to that on my way to work. So like that could be your form of studying. So just like stay curious is my advice. And like the learning will come from like just being curious.
All right, thank you so much to all of you. At this time, if anyone in the audience has a question, feel free to type it in the chat or unmute yourselves and ask. I'll give everyone a couple of minutes if someone's typing. And then in the meantime, is there anything that you guys, oh, there, okay, Elizabeth has a question, go ahead.
Hi, thank you all so much. Quick question. I know you mentioned like these general surgery years are pretty competitive. How many did you apply for? And then my second question is, in terms of like letters of recommendation, can we just use our like IR letters of rec, or should we get like specific like transitional year like letters? I think the TYs and the medicine years are the competitive ones. Surgery is wide open because no one wants to no one wants to do them. So it's like you don't have to apply to that many, to be honest. Um, I don't know a number, like less than 10, I would say. That's how many I think I applied to like maybe like six of them or something like that. Um, and I found that surgery programs, they love IR applicants because they know that they're hardworking and they just kind of have a record of, you know, wanting to do things well. So that's kind of been my experience. I don't think you need to apply to that many, and I think that um, you can kind of sort of get your pick because they're just not as competitive. Oh, and then in terms of letters of rec, yeah, you could just use, I think I just recycled all of my letters. I didn't get any new letters specifically. I just happened to have a surgery letter of rec for my VIR programs and I sent that to surgery programs, but you don't necessarily have to.
Yeah, agreed. I remember I didn't get separate letters for it, but I did tailor my personal statement for the surgery programs. Like I just kind of tweaked my regular BIR one to be tailored to surgery, and then that was the only kind of difference that I did.
If you were applying to a TY or medicine year, it would probably be good to have more diversity in your letters, like maybe a medicine letter of rec. Also, for if you're applying to like diagnostic radiology programs and not just integrated IR programs, they like to have some of them, want like a DR letter and some want like a maybe a medicine letter. My main point is as you go through your clinical rotations, it doesn't hurt to just let attendings know as you rotate through medicine or your diagnostic radiology elective, just let them know that you might want a letter at the end of the rotation, and they can write it, and then you can always decide later if you actually want to attach that to your application, and you'll have the choice to pick and choose which letters for which program. You can mix and match however you want them, but it doesn't hurt just to have that option. Me personally, I went with all IR letters of rec for like all my programs. Um, so it worked out fine for the IR match part, but if I was trying to get into a TY or a DR program or something, maybe it wouldn't have worked so well.
All right, any other questions? I had one kind of oh, there, Dylan. Okay, go ahead.
Hi, can you guys hear me okay?
Yes.
Oh, perfect. So yeah, my question is, I'm a fourth year medical student in Oregon. The vast majority of my fourth year is going to be spent doing VIR, like exclusively, like almost like 16 weeks basically. And I guess I'm just wondering if you guys could go back, would you have done more surgery rotations and like surgical sub-Is versus doing IR, and like did you feel prepared going into a surgery intern year having done a ton of only VIR?
You definitely shouldn't like lose your VIR months where you're like getting to know these different programs for the sake of having another surgery month. It's something that like would be nice. I didn't end up doing that in my fourth year just 'cause I couldn't fit it into my schedule either. You just learn on the job. Like you don't need to prepare. Like genuinely, you don't have to prepare for a surgery intern year. It's, they are relying on your labor and you're there to learn. And that's kind of the extent of it. Like they're not judging you by any means at all. So I recommend keeping as many VIR months as possible.
Totally agree. The surgery year is the prep for VIR, not the other way around. So, keep the priority VIR.
I did the same amount of weeks as you, Dylan, and then um in addition to that, I did do a surgery sub-I, but I don't think it had anything to do to prepare me for the surgery intern year. So don't worry.
Perfect. Thank you.
All right. While we wait for other questions, I had one kind of related. So when you were going back to the letters of rec, would you, if you're asking for a surgery letter of rec, would you ask that preceptor to kind of direct it towards a VIR application, or do you just tell them surgery?
Um, every time I would ask for a letter, at least my surgery people, they would ask me what are you applying to. They probably will ask you what are you applying to because they do tailor their letters um to kind of speak to your strengths. So, um yeah, it shouldn't be like very general because it should be tailored to you exactly. And if you're applying VIR, then it should talk about why you would be a very strong VIR.
Yeah, I think it was the same for me where all of my letters were directed towards VIR. There's no prelim program that's going to look at that and be like, that's weird. Why they're not even applying? This is not a VIR program. They know it's an intern year. Like they know it's a 1 year thing and they understand that that's not what you're planning on doing long term. You don't have to like force your attendings to like tailor like multiple different letters. It's like not a big deal. I will say, when once you become a VIR applicant, I think it makes you less competitive for diagnostic radiology because there's even if you have your attendings like tailor their letters to look more diagnostic heavy, if you're a VIR applicant, your application already screams VIR and everyone can tell. So it's just kind of hard to hide that. And I think that some DR programs have a little bit of bias against that because they know that you don't actually want to do DR. They know you want to do something else. That's just something to keep in mind. But it's not really something that you can control, to be honest.
It's a little bit of a game during your clinical rotations on if you show your cards and tell them what you're going into, or if you kind of act more ambiguous. In hindsight, I think maybe the way I think I would approach it would be to just be straight up with your attendings and just let them know, hey, I'm going into VIR, but I want to do great on this rotation, and here's what skills and what value I can get from this rotation and how it will apply to my future career. I think that might be like a good way to put it.
Thank you. And then just while we wait for any final questions, is there anything that the three of you feel we haven't covered or you'd just like to tell us med students?
I just want to talk a little bit about, in VIR as a specialty, the attrition rate is actually quite high compared to a lot of different specialties. I think it's like 25% of people switch out of VIR and they switch to DR. And I think a lot of that is because med students aren't fully aware of what the specialty entails. And that could be in part because there's not enough exposure or they're getting all these different ideas and it's not what their reality is like when they're a resident. So I try to be as transparent as possible to students. So, if you're, gain from this conversation that, I actually don't really like, you know, touching patients all day. I don't know if I want to do surgery. I don't think that, I could see myself working these long hours. That's something that's totally okay. Or if you're not sure yet, that's something that's totally okay as well. And you can kind of decide that later on. But, like by committing to VIR early, you kind of put yourself in a box versus if you're kind of on the fence, you can always go into DR and specialize later on. There's a lot of different subspecialties in diagnostic where you have a lot of procedures and you're kind of seeing patients all day, but the level of acuity is just a little bit different from what we see in VIR. And that's totally okay too. And there's so many amazing specialties within diagnostic as well. Just something to consider if you're kind of on the fence and you're not exactly sure if it's right for you, there's still time to decide. But if you kind of lock VIR in right now, you might have some regrets later on versus if you stick to DR and kind of leave your options open.
So one thought that I had today, kind of on my drive home from work, was there is such a spectrum of VIR out there in the real world. So many different kinds of jobs, so many different lifestyles and schedules. We really have the best specialty, and if you read something online or you have one experience with one particular VIR attending or one particular department, don't let that shape your whole perspective and keep looking and explore all the different practice settings that you can, all the different procedures that you can, because we are the most heterogeneous specialty. We have all kinds of lifestyles, all kinds of salaries, all kinds of interests, all kinds of procedures. New things are being developed all the time. And it's so exciting. So don't get discouraged. Find as many mentors as you can. Try to get a perspective of what lies ahead years down the road. And just keep an open mind. I know in WCVIS we tend to preach a more kind of hardcore, surgically minded, like warrior type mentality, and I love it. Like I resonate with that as well. But there's still so many flavors of VIR, and there's so many kinds of jobs. So just always keep an open mind, and you can find something for everyone.
All right. Dr. Tillery, I can't see if you've unmuted. My controls are at the bottom, but if not, no worries.
Call me Dulcie.
We'll
Um, no, yeah, I think the biggest piece of advice I would give is a lot of you'll hear as a fourth year, like just pick the easiest intern year. You're going to work very hard for 5 years after that. So like you don't have to put yourself through like that kind of hardship now. And I will respectfully disagree because I think that this is, like you're signing up. If you want to be a VIR, you're kind of signing up for a lifetime of hard work. And like Subash said, there's a lot of different settings of practicing VIR, but the bottom line is you will be working hard. Um, and I think that by signing up for like the easiest intern year or where like you don't have to do much is doing a disservice to yourself because this is this is the beginning of the rest of your life, right? Don't you want to start it out with like being prepared the best possible? Um, I think that you should, and I think that's why a surgery year just makes the most sense. But of course, different people have different opinions. But oh, and I would also say like you're gonna hear so many things about like, but it's so toxic, it's not worth it. Um, and these are kind of like blanket statements, and you should actually do your research into each program, talk to people that came from each one. Like, I was so happy last year. Like, I don't think I would have been happy anywhere else, or like as happy anywhere else. It just was like, everyone was so supportive. It was not toxic in any way. So like, there's proof that like not every surgery year is toxic. So I would just kind of leave you with like do your research, talk to as many people as you can, like Subash said, um, residents, M4s that did rotations at other programs. Like this is really you can't physically go to every program. So like this is the best way you can get information from other programs. Like regardless of if it's a medicine or a TY or surgery, or there will be like toxicity out there in different programs. So that should be like your goal is like, I just want to be at a happy and supportive program where I will learn the most. Um, and then once you find that, I think you'll be set.
All right, well, thank you all so much for your time. We really appreciate it. Heard some great advice here today, and thank you to all the participants for coming as well. Have a great rest of your evening.